So next is assessment. Assessment. Okay, we move on with assessment or your assessment criteria number 3. So what are the things you need to hand over to pass this section of your evaluation station? So 3A is to state the most recent observation and results from assessments undertaken and what changes have occurred. Next is you have to identify the nursing needs or the main nursing needs. Number 3, you have to state the nursing and medical interventions completed. And 3D, you have to state the area of concern. So where are you going to find the answers for this particular station? So remember on your evaluation paper, on the first page, you will see the patient's recent vital signs. Okay. So for 3A, you're basically reading the following, the things written on your paper. Let's say John's most recent observations were as follows. But make sure, guys, when you're doing 3A, you have to analyze this and compare it with your previous assessment. Okay? So on the examination, the scenarios, let's say assessment, normally it happened in the morning. And the evaluation, normally it happens in the evening or in the afternoon. So you have to compare your previous assessment. So remember on this station, you have your news chart, and remember you have your previous documentation. Make sure you write legibly on your notes so you could refer back to your previous results. Okay, so you have to compare it. Let's say on the example here, the patient's news score is 2. Probably during assessment, the patient's news score was 0. So during assessment, your news score, let's say, was 7. Now it's down to 2. You have to compare that. Okay, you have to compare that. Any questions so far with regards to 3A? I will give you an example in a bit. For 3B, you have to identify the main nursing needs. Okay. So Emmer, where are we getting the information from or the answers from? So remember your planning station. Remember on your planning station, you have identified 2 care plans, right? So you're basically stating your 2 problems identified during planning station. And of course, you could add the other problems identified. So remember going back to our old test of competence, remember the section for the main nursing needs or the problems identified is basically this section. Okay, you are just basically saying instead of writing this section. So next is 3C. So in here, the examples would be, let's say, pain, shortness of breath, let's say, a risk of fall, let's say, risk of infection or infection. So those might be your the possible things that you could tell the assessor when you reach this section. 3C is states nursing and medical interventions completed. So Emma, where are we getting the information from? So remember on your planning station, the interventions that you've given. Okay. So you are basically reading your care plans when you reach assessment station. Remember, it says here, states the nursing and medical interventions completed. So that means you've given it already. So the answer should come from your planning paper, okay? On the nursing care provided, okay? Just use past tense when you're handing over on this section, okay? Any question, I'll give an example. You don't need to read everything, just summarize it as you can see on your screen, okay? Just summarize the intervention. Examples are, let's say, monitor the patient's observations and escalate it as per news policy. That might be your 3C. Let's say, administered paracetamol and monitor its effectiveness. Another example is to say, educated the patient about hand hygiene, or say educated, say reposition the patient in a high Fowler's position. Those might be your intervention, your nursing intervention. You could say it on this section. And 3D, you have to state the area of your concern. So what you could say on this portion is, you could say your concerns about the patient and the patient's concern. Okay. So I will give you an example shortly. There you go. It's kind of long. Okay. So it's the longer part or the longest part of your evaluation station. So the example is on your screen. So John's most recent news is 7. The temperature is 36.7. The pulse is 115. The respiration is 21. Oxygen saturation is 93. The blood pressure is 101/87. which is the same news score as before. His temperature and respiration has improved, but his oxygen saturation is still low and his pulse is notably high. Okay? If after reading this, um you're analyzing the patient's current or the recent observation and you're comparing it from your previous assessments. Okay. Next is I have identified shortness of breath and chest pain as John's main nursing needs. Again, you could also add the other problems you've identified. Next is I have monitored John's observation and escalated as per news policy. I repositioned John in a comfortable position and provided a safe environment. I taught him deep breathing exercises. I administered analgesia for pain and monitored its effectiveness. Also educated him about diversional activities. So those are the possible things that you might be saying in this section. And lastly, John was short of breath and was in pain. But after my nursing intervention, those problems improved. John was allergic to penicillin and it was prescribed on the drug chart, but I have managed to escalate this to be removed out of the drug chart. John was also concerned and anxious about his wife, who is pregnant. Okay, so this is an example of your assessment. Any questions so far? We will now go with the next section. So this is the last section of your evaluation station, the recommendation. Okay, so you have to state what is required of the person taking the handover and process a realistic plan of action. So this is an example. So my recommendations are to continue to monitor John's observation and news score, most especially his respiration and pulse rate. Continue the care plan for his shortness of breath and pain. Review and escalate as necessary. Make sure not to administer any medications containing penicillin to John. Update and lastly, update his wife about his condition and if possible, arrange a phone call with her once John is better. Okay, so that is an example of your recommendation or what you're going to hand over during your recommendation. It's what you need to, this section, it talks about what do you want the next person to do or to continue with regards to John's care. Okay. Any questions so far with our recommendation? So this one is straightforward. So I hate to say the word, but you have to really memorize the marking criteria. So for this particular series of our webinar rather, it's like memorizing the marking criteria, most especially when we go to evidence-based practice and professional values in the next couple of minutes. I hope that is useful. I think a couple of you guys are doing or sitting your examination soon. So hopefully this is useful. So I'll think of a scenario before we move on with evidence-based practice and professional value. Let's say, let's say the scenario is all about um, anxiety, depression. So let's say your patient is depressed. That is your scenario. So let's start from the beginning. Okay. Situation. Of course, you have to introduce yourself. Let's say my name is Emmer. So my name is Emmer and I am the nurse looking after, let's say I am in the community, Austin House. So the patient's name, let's say, I'll think of a name. Juan de la Cruz. His number is, hospital number is 12345. Date of birth, let's say, today. The location is Austin House. The reason for handover, I'm handing over this patient because the patient scored, let's say, 15 on his PHQ-9. Okay. And I wanted to refer the patient to you guys for more advice in terms of depression and management, of course. Okay, the background. Again, you have to read the overview of the recent history. You're just basically reading it. And let's go to 3C, the current findings. So what you could talk about in this section, you focus more on your PHQ-9 result. Okay. Let's say on the PHQ-9 result, let's say the patient has loss of appetite. You talk about that. Okay. Let's say the patient lost the will um, what are the other things on your PHQ9? Appetite, to say the problems with sleeping, overeating. So you focus on those areas of your PHQ9. So you talk about that on this section, the current events and details from the findings during assessment. Because if you're doing the PHQ9, of course, um, depression rather, you will be talking more about PHQ9. Next is, let's say, assessment. So of course, for 3A, you are just reading the one written on your evaluation paper. Next is identify the main nursing needs. Again, the information that we will be telling on this section are your care plans. So you're reading or you're handing over your two care plans, your the two problems identify, and your interventions, and list the area of concern. Okay, again, your concern and the patient's concern. You could say that on this section. And lastly, for your recommendation, of course, you talk about your recommendation in terms of your patient. Probably the recommendation for, let's say, a depressed patient is to continue, of course, doing the PHQ9 regularly and see if the patient score is improving or not. What else? Probably you could reinforce the knowledge in terms of medication compliance. Remember, patient with depression, they take medication, so make sure it's vital or it's imperative that we educate them in terms of medication compliance. Okay, so those are your possible recommendations for depression. Um, and that is it. Okay, again, that's just an example. Um, because I don't have the sample on my screen here for the depression, but hopefully that is useful. Okay, I hope that is useful. Any question in terms of evaluation. Again, it's just a matter of finding where the answers are. So when you do your notes, probably you spend more time on your assessment and recommendation because you have to think of the things that you have to really tell the assessors, most especially your recommendation. Okay, hopefully that is useful for your examination. So that is, I think that ends our evaluation section. So the other criteria that you have to keep in mind when you're doing evaluations are the following. So make sure that your communication is clear, okay, and appropriate. Make sure the assessor could understand you, okay, and make sure it's systematic. I always tell our candidates, please follow the SBAR format. Of course, you cannot start with your recommendation first. You need to introduce yourself first, okay? So remember the marking criteria. So of course, you start with situation. Next is your background. Next is your assessment, and of course your recommendation. Okay. So it's also worth saying what you're doing. Let's say the situation is, the background is, assessment are, recommendations are. You say that so you will remember what you're saying or what you're trying to say or hand over to the assessor. And lastly, again, I think this is present for all the criteria nowadays. You will see this, you have to act professionally. So you know what is required of you on this criteria. All right. So we are now down to our last two sections of our um teaching for today's webinar. Okay. So our webinar today is kind of chill as compared to our previous webinars.